Okay, so I did my topic on how has COVID-19 impacted mental health. This was my research, and so the introduction includes what is COVID-19, how did it impact a person's life, the impact on education, the impact on students, and mental health. So I'm going to start off with what is COVID-19. So COVID-19 is an infectious disease caused by the SARS COVID 2 virus. The outbreak of the coronavirus in December 2019 began in Wuhan, China, and it was not declared a pandemic until March 2020. There are 645 million all-time confirmed cases and 6.64 million of all-time deaths since the outbreak of COVID-19. It changed the way a person performs their life. There were many people who lost their job and children and adolescents who had to do their schooling from home. It is important to know that not everyone was used to this life change. During this time of social isolation, children and teens are being exposed to excessive media coverage of the pandemic. The media is providing updates on nationwide situations, and it is also letting people know how to adjust to social distancing. However, in another way, it is also spreading misinformation. Many families have been isolated at home and are not able to receive in person support. And above all, they are under great stress. Not being able to visit family, friends, or even simply going out for dinner can, can impact a person mentally by causing stress. Unfortunately, social distancing measures can result to be in social isolation in an abusive home. Studies from previous natural disasters, financial recessions, and outbreaks like Ebola in West Africa that occurred in 2014 through 2016 disclosed increased rates of child abuse and neglect. In a survey, parents have reported an increase in incidents such as shouting, yelling, and even physically hitting their children. There are many variables that may contribute to the mental health status of college students throughout the pandemic. This includes their family life background and of all their identity. The, the aim is to investigate the mental health college students from the ages of 18 through 24-year-olds to see if these impacts were significant in these specific groups. So, the impact on college education, on student education. So, the virus spreads from person to person through saliva, touch, and etc. There are many countries in the world who are asking individuals to apply social distance in order to be able to lower the growth of the COVID-19 pandemic. Most governments across the world closed down schools and to stop the spread of COVID-19. The U.S. had the highest confirmed COVID-19 infections. Nationwide, there has been 6 major influenza epidemics in the past 140 years. That being said, the 1918 flu pandemic was the most severe, which caused 50 to 100 million deaths. In March 2020, the U.S. population mandated top live in their household to avoid human interaction to the public. More than 1,000 colleges and universities were closed down in person. This so this closed down in-person classes and activities on campus were canceled, which impacted several students. The school's closure due to COVID-19 does not only affect students equally. The students who come from a less advantaged background highly suffered during COVID-19 than advantaged students. These students who come from low-income families and less educational levels with poor learning motivation suffer the most during this crisis. So now the impact on students and mental health. With the continuing spread of the pandemic, there has been strict isolation measures and delays in starting university, schools, and colleges throughout the country. This has affected the mental health of students. In the beginning of the pandemic, 25% of students experienced anxiety due to the COVID-19 outbreak. The students' mental health is highly affected when faced with a public emergency. This means that the students need support from community, family, and as much support as they can get. When in quarantine, people start a new life. Quarantine is associated with 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 social, psychological, and economic hardships. Research has conducted to postgraduate students with living in quarantine. The data was conducted by surveys. There was 30 surveys that were handed out to postgraduate students asking them questions. The questions consisted of how has COVID-19 impacted their mental health, what behaviors did they develop, did they have any concerns of their family. Being able to understand these experiences, attitudes, and beliefs can show if COVID-19 has affected them personally. According to the World Health Organization, the pandemic caused stress to many individuals. A questionnaire was then conducted in China to be able to see the cognition, psychological state, anxiety, and depression levels of students during 2019. There were 509 students that were collected with an internet questionnaire. They were used to value each anxiety and depression symptom. A lot of the students agreed to reduce going out and gatherings. Students in China's anxiety and depression levels were higher than the national normal. During the COVID-19 epidemic, the students' anxiety and depression levels drastically increased. Education has been the pillar of development in each and every country. This means that it is the main development and growth of all countries. The United Nations Education, Scientific, and Cultural Organization reported that 87% of the world's student population is being affected by COVID-19 school closure. In Niranjan's study, it showed that COVID-19 did not only impact the overall economy in our day-to-day life, but it has affected people emotionally, physically, and mentally. Since during school closures, both boy and girl students in rural areas might be obligated to fully support their families and their farm. The pandemic can most likely have a serious influence on the careers of these students. So methods, it included participants from the ages of 18 to 24. It was either male or female, and they must have been attending college during the strike of COVID-19. So the survey was conducted online on I think it was Pollfish. So Pollfish is a survey research platform online that uses random device engagement, and that's where the questions were put on, and college students answered them there. Results. Mentally, COVID-19 affected everyone. This includes any human being, no matter their current situation. The results showed that students who were closer to graduating faced increases in anxiety, so that was 60%, feeling lonely 54%, and depression 60%. There were some that reported being worried about taking care of the family, others thinking about how taking care of the family is going to affect their future plans, and a majority of the students found it hard to complete their school year at home, especially for those families that are not doing good at home. So this is just showing how the students were doing during the pandemic when they were learning from home. So let's start off with this light green one. So it says that 6.79% were feeling at ease. Others weren't really thinking about anything. This is 3.295%. The fear of infection was 4.98%. Worries about finances were close to 60%. Anxiety about lack of proactivity was 19.03%. Concern about school and continuing education was 19.175%. Concern about future job offers was 10.75%. And worries for health of the loved ones was 20.04%. So this just shows you how a student's mind was not only focusing on school, but they were also focusing on this, like they also had like their personal problems. So as you can see, like finances was a huge one, and then school and even continuing education was a big part of it. And you can see like anxiety too, and the health of like a loved one. So it just shows, it gives you a clear understanding of how of what they were thinking and how it affected them. Discussion. COVID-19 has brought severe education and social impacts. This includes the closure of college campuses and introducing online learning and social distancing in universities for the future. College students did not have a choice, and they were obligated to not experience college, which means social gatherings, group studying, in-person classes, or meetings. And as the survey reads, this caused many students to develop illnesses like loneliness, depression, and of all anxiety. And these are my references. Thank you.